Today we speak with homeopath Dr Aadil Chimthanawala, who is a fourth-generation homeopath. Both of his parents are homeopaths, as well as his gorgeous wife. Dr Aadil specialises in homeopathic cardiology, and he's delivered lectures on homeopathy in cardiology at national and international seminars and symposia in California, Kuala Lumpur, Australia, Morocco, and many more places around the world. He's also the author of 10 textbooks of homeopathy, and be sure to check out his hugely popular YouTube channel. For those of you who speak English, he does have subtitles to his Hindi videos, so you can still benefit from his expertise. He has over 75,000 subscribers and over 800 videos, so there is a wealth of information. It was so awesome to see his passion for homeopathy shine through in our interview today. And even after all these years of practicing, that he is still so excited about homeopathy. You're also going to hear some amazing stories of some of the most incredible cures in some of the most critically ill clients. And if you didn't think homeopathy was amazing before, you certainly will after this episode. So enjoy.
Welcome to the Homeopathy Hangout, where we discuss all things homeopathy from around the world. And now my mum and your host, Eugenie Kruger.
Hello, homies, and a very warm welcome to Homeopathy Hangout. Today we speak with homeopath Dr. Aadil Chimthanawala. That is the funnest surname ever. Welcome, Adil.
Thank you so much, Eugene. It's indeed a great time to be with you, and I hope I can share some insights about what our work is we are doing in homeopathy in India, and luckily in Australia. In 2015 and 2016, we have got lots of Australian students coming over here, and I've been teaching Australians, and it's fun to work with people.
Yeah,
I'm crazy about homeopathy.
Absolutely. And I know you've been over in the east coast of Australia to teach there. You are going to have to come to Perth once all this COVID craziness is done. I'm going to make sure that I get you and your gorgeous wife over here.
Sure, definitely.
Excellent. Now, I am so jealous. You have got 75,000 people on your YouTube channel. I only have 300. So you are definitely doing something right. Can you tell us, how did you first discover homeopathy?
Well, I'm the fourth generation homeopath in my family. So homeopathy in our family started way back in 1912.
Wow.
The first clinic my great-grandfather inaugurated, was sad. And at that time, the ruler of Nagpur, the place where we live is Nagpur. And Nagpur had a kingdom. There were small kingdoms in India. So this was before independence, much before independence. So the ruler of Nagpur somehow had got tuberculosis. Not he, but his children. And my great-grandfather happened to treat two of his children, one with pulsatilla, another with I don't know which drug. It took about 3 to 4 months, and it was a marked improvement. Now, how my great-grandfather learned homeopathy is a totally different story. But since then, rulers started, why don't you practice homeopathy? What's stopping you? So then the seeds were sown, and now we are a full-fledged tree with lots and lots of branches, and it's been an amazing journey. But then over time, we have believed that, even my father and myself, we come from modern medicine. And once you have a background of modern medicine, it becomes much more clear applying the philosophy of homeopathy in modern medicine and exactly defining the scope and limitations of a particular therapy in your patient. Not only that, researches should be conducted on a proper level. Acceptable level, scientific level, evidence-based homeopathy. So I firmly believe in evidence-based homeopathy. And over a period of, say, it's been 22 years now. So 22 years, every single year, we have been proving a drug. There's a concept of drug proving in homeopathy for people who don't know about homeopathy. That is, we take a drug and give it to healthy human beings, and whatever the reaction the human being has after taking the drug is diligently recorded, and that is called as a proving. And then we use those same symptoms in a diseased person. So till now, we have finished about 46 remedies. And likewise, a lot of studies have been done. I was doing my MBBS, that is my allopathic course. And that time, although my parents were homeopathic, my mother's a homeopathic gynecologist and obstetrician, and I used to see her using lycopodium to correct the fetal lie. And I used to literally laugh at it. I said, how is it possible at that time? How is it possible that sugar pills can correct the lie of the baby and all? but that was routine for her. Like the pains did not come, 2 or 3 doses of pulsatilla or colifilam, and the baby used to be born. So it was an absolutely routine thing for us to see that thing. But I had never experienced. So when I went into my medical practice, not medical practice, my medical school,
Training.
and then I was in the Department of Gynecology and Obstetrics. So government college means huge amount of patients. Like every 3 minutes or 5 minutes, we are having a labor. People
Wow.
it's full. And there are so many complications. People here are so poor. So I started deciding using homeopathy there. They took permission, I started. And the things became so easy for them. At that time, I saluted my mom and I said, you can prevent so many LSCS, like hysterectomies were prevented, LSCS in our hospital. I used to tell her, please at least do one surgery. And she said, no, there's no need with homeopathy.
Wow. So what is LSCS?
LSCS, lower section, cesarean section.
Okay, gotcha. C-section. Cool.
So C-sections were not done because there were maximum normal deliveries, normal labors in our and there was no need with homeopathy. But so that was the thing. And my father has been practicing homeopathy in oncology, cancers.
So both your parents are homeopaths?
Yeah. And my wife, she's a pediatrician, homeopathic pediatrician, and I'm a homeopathic cardiology.
Amazing.
So what happened was, so I had this in mind, but I always wanted to do cardiology. Like from the very beginning, I wanted to be a cardiologist. So anyway, I entered cardiology and my first year of my housemanship, we had a very interesting case. It was an ICCU, so I was in charge of the ICCU. And a lady, aged around 48 years, and her son, both of them were rushed into an emergency. And they were having palpitations and severe breathlessness. And both of them, incidentally, had a heart rate of 260 to 280 beats per minute. So they were having atrial fibrillation.
Both of them?
Both of them.
That's strange.
Yeah, so that's strange. And it started with the mom. So mom was originally a case of rheumatic heart disease with mitral stenosis. And she developed atrial fibrillation. The son was not. Son had a low atrial fibrillation. It was the first attack in his life. Now, initially, since I was in Homeopathic Medical College, obviously, we had to give drugs and all. And they were extremely poor. Extremely poor means very poor. Day one passed, no results. They were given IV drips, they were given shocks. And then we were planning something to do with, some intervention we were planning. But then there was no money. Even in medical college, you require some amount of money in India. There's no insurance. There's nothing for Indians here.
Wow.
Then at that time I said, why not discuss? See, I was not that much into homeopathy at that time. I had a background of homeopathy, but I did not know homeopathy myself.
So you were still purely medical doctor at that stage?
Yeah.
Wow.
So I went to my dad and every Saturday we have a clinical meeting. So we discuss cases. So at that time I put these two cases. Like, can homeopathy do something? And if something can be done, then we should do it. So then I gave them the entire history. So my dad said, what are your observations? I said, what are my observations? No, what did you observe? I said, I told you the BP, the pulse. I said, I don't want the BP and pulse and all these parameters there on paper. The machine has observed that. ECG, EKG, the machine has observed. What have you observed? I said, I only observed that this mother, she's extremely fearful. That is the observation I wanted. I said, okay, then so what? So give her aconite. I said, okay. How about the son? I told him the same thing. I said, what have you observed in the son? Is he a calm person? I said, no, nothing, no, not even calm, not even agitated. He's okay, but he has a very fast heart rate and he's having palpitations. Okay. How old is he? He's around 20 years old. And did you see his teeth? I said, yeah. There were stains of tobacco. Give him tobacco. I said, but they both have got the same thing, atrial fibrillation. Yes. But one will receive tobacco and the other will receive aconite. Believe me, Eugene, it was, a miracle that it took us only about half an hour and both heart rates were settled. So we have got evidence base at that time. And this was given in the presence of the entire team. Like all the other cardiologists were there. And they could actually see the power of homeopathy. And in spite of, there were 48 hours that passed, nothing was happening. In spite of the best medical center, because we were working in the tertiary medical center, very well equipped allopathic cardiac hospital, and no results. And only in half an hour, 2 patients with the same disease responding to two different drugs given on totally two different reasons. One was state of disposition, that was restlessness and fearfulness of that mother. And this was a long-term tobacco chewer in 20 years old male. And both were perfect. They were discharged. And that was the foundation that, no, I have to practice homeopathy now.
Yeah.
So it was a calling for me to practice homeopathy. After that, I completed my DNB medicine, that is MD in homeopathy. Sorry, MD in allopathy. I I did my BHMS, which is a separate degree, like MBBS. Then I did MD in homeopathy and PhD in homeopathy.
Wow. I mean, I completely believe you because, I have not had the privilege of treating a case like that. But, I will never forget, just a couple of weeks ago, my son had a fever and he was completely delirious. He said to me, "Mummy, who are those people behind you?" And he was speaking in tongues. I mean, my husband and I were freaking out. 1 dose of Belladonna 200C in under 30 seconds. And he was like, "Oh, hi, Mummy. What are you doing here?" And my husband was there to observe it. So I know, it's just absolutely unbelievable, Adil, but that is a cool story. I want to know from you, though, what is it about the human heart that fascinates you so much? How did you come to decide that cardiology is your passion?
Well, from the very, very, very beginning, when I entered medical school, it was not cardiology. It was basically intensive patients, patients who really needed medical care. So that fascinated me. So half of the time I was in my ICU. I did not, in my first year also, after the college was over, I used to go into the ICU and just sit, just observe. I was observing what they did. And then no one used to let me touch anyone or anything. You're just first year, second year. So, but then that fascination was always there. What happens to a person? How do you save a life? Because from the very beginning, my father has taught me the first duty of a doctor is to save a life. If you have saved a life, your entire degree has not gone in vain. Just one life is enough. Mm-hmm. So that was always there with me. Then I found out India is the world leader, unfortunately, in ischemic heart disease. Second, it's a world leader in diabetes, in hypertension. And unfortunately, India and Indians abroad, we have got this heart disease below 40 years of age. So young Indians suffer from these metabolic problems, of what we call syndrome X, to a very large extent. And I said, if something has to be done, I need to stop this epidemic. I need to do something because had allopathy an answer, this would not have been the state of my country. So I need to focus something and bring in a revolution or something from different stream. And why not homeopathy? So that was reason. And then this case happened in my housemanship. And then it was confirmed that I have to do cardiology only.
Amazing.
So then I went to my dad and asked him, what do you think about specialization? Because homeopathy itself is a specialization. So why do you need to do a sub-specialization like only in cardiology? I said, no one has done this, but I want to do. Then he said, okay, if you want to do, then you have to do it diligently. Then you'll not take up cases of migraine. You're not going to take up cases of asthma, or you're not going to take cases of skin. If you have focus on cardiology, different streams of cardiology, different branches and sub-branches of cardiology, and evolve it to an extent that is applicable by a common man in the grossest of grossest pathological cardiac cases. And this dream really came true now in COVID, particularly because where COVID is basically not a respiratory disease. It's a disease of the blood. It's a disease of cardiovascular system. It's a disease wherein the hemoglobin is broken down by the virus. The heme and the globin breaks down. The heme starts collecting. That's why you have got this blockages all over. And that's why numerous cases of strokes or anginas and coronary artery events.
Yeah.
And so many patients. No, myocarditis is separate. It's a viral fever. That's a different thing. But we are getting lots and lots of people suffering from stroke and ischemic heart disease. Fresh clots, myocardial infarctions, and patients are gone. Young people, old people. And the way homeopathy has helped these people, I mean, it's a blessing. So, for all these years we have been working on a lower pace, but this epidemic has really given us a chance to give homeopathy and see its effects and appreciate and salute the master Hahnemann. That this Hahnemann Day was dedicated to the master. Because of his homeopathy, we could save so many lives, and that too with so meager amount of money. very less hospitalization, very less allopathic or any other system of medicine drugging, and giving symptomatic relief in a very fast and a easy method. So I think what more do we want in health?
Well, absolutely. It feels, we've been celebrating Homeopathy Awareness Week from the 10th to the 16th of April every year for I don't know how many years, but it really feels like this year it had ramped up and I was seeing stuff everywhere. I mean, I had a daily podcast during that time and so many other homeopaths were doing amazing things this year to really celebrate Homeopathy Awareness Week because I feel we all have got a renewed respect for homeopathy after COVID and how homeopathy was really able, homeopathy through the couple of past 2 centuries have really shined during pandemics. So this has been so good. Quick question, Adil. I think I heard that in India, the homeopaths weren't allowed to treat COVID cases initially, but then after that, they were saying, yes, please do, because they were overrun with cases.
Yeah.
And then the homeopaths in India was shining.
So what happened was initially in 2020, when the pandemic set in India, there was a lockdown and people did not know. So before that, I would want to say one thing. Somewhere in February, one of my patient's daughter, she was studying in Wuhan. She is doing MBBS in Wuhan, in one of the medical universities. And when this news came up in early Jan that there's an epidemic going on, I somehow had a hunch that it may spread to other places. So I asked this girl that give me some first-hand information about this virus. I don't know anything about this virus and what is actually happening there. At that time, the pandemic was yet to be declared. Only in China and those areas it was there. So she told me everything, and then I uploaded a video on YouTube. Suppose if a case comes to us, what a homeopath can do, or how can a homeopath approach such a case? So I gave the remedies like gelsemium, how it may act, or it may like justicia, and other remedies, what probable remedies, camphor and all. So the limited amount of information that time we had a 30,000, first day it was 30,000 views were there and lots of comments. And by the end of the week, the video was taken down.
Wow. Are you serious?
And I get a notice that you are violating our community norms.
No.
This is misinformation. I did not say do things. How would a homeopath approach? Suppose if he gets the case.
Oh, that's insane. So let's just recap this. So you did this video on YouTube. It got 30,000 views. And by the end of that week, it got taken down for supposedly violating their code of conduct.
Then I said, what to do? I had no clue. What did I violate? I did not say, in the first sentence I uttered, I have not treated or seen a single case, but it's a hypothesis. See, a hypothesis you can put, right?
Yes.
This is the freedom of speech. We are not misleading, but then it was taken down.
Freedom of speech as long as you don't speak the truth.
Yeah, but then, and after some time, again, I posted a video which was again taken down. And they said, if you do this, then we'll take off your channel.
Ah, you kidding?
So then I did not, I did not know what to do. Then I put a small clip on Facebook. They also took it out.
No, far out. Well, that's loud and clear. And that was over 2 years ago now, hey? So that was right at the before it even had kicked off.
So what happened then? What happened was initially people were setting up, people did not know about this virus. So the allopaths took lead, etc. And then everything was established. But then the Ayush ministry, that is a combination, the alternative system, ministry of alternative medicines, Ayurveda, yoga, homeopathy, Unani, it's a set of alternative system. So they took a stand. And luckily, the Central Council of Homeopathy, they proposed arsenic alb as one of the preventives in homeopathy for this virus.
Yeah.
And the whole country had purchased arsenic alb.
Yeah, as like a homeopathic immunization.
Yeah. Unfortunately, they had to take off the word immunization, and because there were no studies done, there was no proof. They have not seen. So this entire thing went. But still, during that 1 month or 2 months time, whole India, every single household had purchased arsenic alb and were taking.
Yeah.
But then slowly and steadily by August or September, complications started coming up. First wave, we did not see many complications. First wave, okay, we had lots of cases, but then there were flu cases. And then, so first wave went away. Then in between came the vaccinations with their side effects. Again, we are not supposed to speak about those side effects of vaccinations. Like, no, I'm not talking about fever and cough and cold and all these things.
We can talk about the side effects of any other medication. We can talk about the side effects of antibiotics or hypertensives or anything else, but not side effects of vaccinations, apparently.
Anyway, so that came. And this time second wave, we realized that modern medicine was not working at all. That was the time when homeopaths were actually invited, please do something. Not only homeopaths, people from every other pathy were invited, do something. Because people were dying because of lack of oxygen in India. We did not have oxygen cylinders in our hospitals. Every single hospital bed was full. The second wave, people were afflicted by mucormycosis, by candidiasis, because of using a lot of steroids and this. So there was a rampant demand for some alternate medicine. That was time when really the prowess of homeopathy shone, and luckily, many homeopaths I know who are diligently working the system had a chance, and they did their best in their own methodology to treat patients, to heal patients. Then it became a good synchrony between allopats and homeopaths. Allopathic ICCUs, homeopaths also treating, allopats giving the basic support like life support like IV saline and all those things, and the patient getting better. So this came up. So we have a homeopathic hospital. And we also applied that I want to treat. They said, no. If you can treat because I have an MBBS degree, allopathy all day. You can treat by allopathy. I said, I don't want to treat by allopathy. I want to treat in my hospital with homeopathy. But you have to give me a chance, because they were designated hospitals. To treat COVID. You just cannot treat any COVID patient in any hospital. So you have to take the permission from government. Can I treat with homeopathy?
Wow.
So, but then, okay, we could show it in our different areas, and lots of people were really benefited. And I'm thankful that this system is there. And lots of new rubrics came up. We came to know about those drugs which we have never used, or we had used very little in our life, like aspartosperma. I had made a video of aspartosperma about in 2017, because it is a drug which I only used, very few people use only in
I've heard
ICC.
of it. Can you say it again?
Aspartosperma.
Okay.
Querbaco.
Don't know that one.
It is a fantastic remedy. It increases your SpO2. The oxygen, if your oxygen is, let's say, less than 93%, it comes up.
Can you spell it for me?
Aspido. ASPIDO. SPERMA.
Okay, thanks. Some research for afterwards.
Please do so. It was a drug which has saved so many lives. Like people are we could take out patients from ventilator, and they could breathe properly. The oxygen requirements decreased. Then a drug called antimony Rs.
I know that one. I just quickly want to say as well, when you say drug, you mean homeopathic remedy, hey?
Homeopathic
remedy. Yeah, I'm just saying for the Western Westerners listening, they probably wouldn't know that terminology, that often the homeopathic remedies can be called drugs as well. But you are meaning the homeopathic remedy, aspartosperma, and antimonium arsenicum as well.
Yeah. Now, drugs like antimony arsenicum, antimony tartaricum. So these were fantastic remedies, because after the patient has come out of the ventilator, you have got a lot of fibrosis, pulmonary fibrosis, the lungs shrink. Now, what do you do with that, with those patients? Lobelia inflata is a fantastic remedy. Coca. All these remedies have helped to rehabilitate all these patients to go home, live their normal life, and we could see changes in CT scans, MRIs.
Oh, that's amazing.
So there was evidence-based homeopathy at work in this pandemic, particularly in the last second wave in India, which we had suffered.
I mean, if you've got a CT scan to confirm that, you can't really argue with that. Just quickly for our listeners, lobelia is this beautiful little blue flower. It's a remedy that's really good for the lungs. And the other one that Adil was saying is coca, which is made from the coca leaf, which obviously, they chew the leaves when they go climb high altitude mountains. And so we have the remedy that's made from that, that's good for oxygenating the lungs. So Adil, what sort of scope does homeopathy have when it comes to cardiac disorders? I mean, a lot of people would think, cardiac issues, oh no, that's too far gone. You can't help with homeopathy. But what would you say is the scope of homeopathy when it comes to treating cardiac disorders?
So when I started my practice in homeopathy, as my parents had told me that you are going to practice only homeopathic cardiology, now nothing else. So I started my clinic, and I used to wait for patients. And cardiac patients they did come, but problem was they came for keloids. No, doctor, don't treat for cardiology. cardiologist is taking care of our heart. You only treat this keloids. I said, I'm not. I want to treat your cardiac case. I want to treat your high blood pressure. I want to treat your diabetes. I want to treat your clots. No. Don't do that. I want to treat your valves. No. So there was a period of 7 months wherein I used to refuse patients. I said, no. If you want to treat asthma, then go to my go somewhere else. But
colleague.
So then what happened was, one fine day, a gentleman aged around 72, he came to me and he said, Doctor, I read the board, Homeopathic Cardiology. I said, yeah, this is a angiogram and I want to get myself treated. I said, really, for cardiology? Yeah. Okay. The problem was, there are no books, there's no literature for homeopathic cardiology. So it was new. I had to reinvent things and take it forward. So I said, okay. So it was a settled case, a triple vessel disease. All the 3 vessels were blocked. He was hypertensive and this gentleman was 72 and he did not want to undergo a bypass surgery. I said, fine, I'll try. This is my first case. Since it was my first case, I could not muster the courage to charge him because I was more obliged for
Yeah, exactly. We learn so much from our clients.
Doctor, be professional. Please take your charges and treat me properly as it should be. I said, okay. So we took the entire history and this constitutional remedy was Aura Metallica. So constitutional medicine, we started with because he did not have any symptoms as such and he was already on allopathic drugs like aspirin and cholesterol reducing agents and all those things. So he did not have symptoms, but he did not want to undergo bypass surgery. He was having some chest discomfort, but then that was maintained. So I started giving Aura Metallica without any hopes because I said, just try and see. First month, second month, but the first month he started feeling better. I said, okay, so something is positive.
Heading in the right direction.
Yeah. Then second month, I increased the potency started with 200 C. Then we started to give him 1 M potency. And he came at 9 p.m. He was the last patient came. Doctor, I need to see you. See this. I took off his shirt. I said, what is this? He got extensive tinea. What is this? This fungal infection has never occurred. It has only occurred when I was in college days. For all these 50, 70 years of my life, 60 years of my life, this has never come. I took that dose and this has come now. I want to get treated. I said, sir, please bear with me. You did not give me this history. He had forgotten. So in my case taking, there was no mention. But once it came up, he remembered that he had got, I said, this is Herring's laws of cure.
Yeah.
I am heading in the right direction. We were monitoring his blood pressure. And that was the first time in all these days after Aura Metallicum, the BP had come to very near normal. It was 110 by 64, 68. Wow. So we had to stop his antihypertensive.
Absolutely amazing. I quickly want to mention that to our listeners as well. So what Adil is saying here, like Herring's law of cure says that it will heal from the most recent complaint to the oldest complaint. So what he's saying is this patient of his had this rash on his body when he was, about 20 years old, and he's never had it since. But now at age 70, when he started taking the Aura Muriaticum, this rash came back for the first time in 50 years, which is actually a sign for us that it's the correct remedy because it is bringing up symptoms that he used to have ages ago and was probably treated with allopathic medicine and suppressed. And now his body was able to bring it up and heal it. So that's an incredible response. Sorry, please continue.
So then he was on placebo because Aura Metallicum had really done his job and he was really well. And slowly and steadily, we started decreasing his allopathic drugs. We stopped his anti-cholesterol drugs because his diet and all were very well controlled, pure vegetarian diet. So it did not matter. So only drug which was left was the blood thinning agent, that is aspirin. We can't legally stop that. Okay. Then about 8 months had passed and till now, then he came back. He and his son came. So when his son entered my clinic, I stood up. This son, his son happened to be the professor of medicine, allopathic professor of medicine, my professor of medicine.
No.
And deadly against homeopathy. Oh. Both of them came, hi Adil. So you have left allopathy and practicing homeopathy. I said, sir, yes. No one believed that I could practice homeopathy. I said, yeah, this is my calling and I'm practicing. So now he himself is a cardiologist, this gentleman.
No.
And this father of his, he did not tell me ever once that his son was mighty. He knew all along.
You have some great stories, Adil. That is so good.
Then they gave him. They showed me his recent angiogram report, and the plaques had reduced by 50% less. I mean, 50%. The entire all the three arteries, 50% plaques had reduced. Then the first time that sir said, when the professor said, how is it possible? What is the mechanism behind this? I said, come and learn homeopathy, sir. I'll tell you everything about the mechanism. That was the day, and today I had never to look back. I never regret the decision of taking homeopathic cardiology as a separate branch of homeopathy.
That is, I feel like I need to applaud. That was just, and you're a great storyteller as well, by the way. That was amazing. And I believe you've written 11 books now on homeopathic cardiology as well. So you literally are the man that's written the textbooks on, how to use homeopathy with cardiology.
So let us discuss the scope in short. There are about 7 to 8 disease disorders in cardiology. The first and foremost is hypertension and hypertensive heart disease. And I've been telling you, homeopathy is a fantastic method of controlling high blood pressure. Not only high blood pressure, but the complications of hypertension, like cardiomyopathy, hypertensive heart disease, like the elongation of the heart, the renal hypertension, that is because of the chronic kidney disease. Like so many patients, with homeopathy, we take them off dialysis. What's wrong? We can prevent transplants. What's wrong with that? So that's one area. Hypertension control. I think if you only do this, we have really won the race. Second is ischemic heart disease, angina pectoris, and the blockages in the heart. Acute myocardial infarction does not respond to homeopathy because that's a medical emergency that requires thrombolysis, streptokinase, etc. So leaving that part, we can actually treat coronary artery disease, and you'll be amazed. There are about 360 to 400 remedies, each acting in different way, in different sorts of angina pectoris, the classical angina pectoris. And nowadays, what has happened is diabetics. Diabetics are a unique set of patients because they don't present the classical angina pectoris of chest pain. The classical angina is chest discomfort radiating to the left side to the fingers. This is classic, along with a little bit of sweating. But the non-classical present angina variants is pain in the left jaw, pain in the right jaw, pain in the right side of the chest, pain radiating to the right arm, pain radiating to the back. And this happens in diabetics. Or no pain, just a sensation as if a ball is lodged in the cardiac end of the stomach. These vague sensations of just choking. And we have got fantastic medicines. I mean, from the snake kingdom, that is Naja or Lachesis, or for that matter, Carbovage. So many medicines are there. I mean, it's difficult to name. And they give results in minutes. And that's the reason why you could open a hospital in homeopathy. See, it takes courage. You cannot, it's very easy to give in routine practice, in OPD practice, but the patient is in front of you. And at that time, if you can't treat the patient with your drugs, homeopathic drugs, then it becomes a very difficult situation. But luckily, homeopathy has always obliged us. And patients are there and they get well. And I don't have to keep the patients for 3 to 4, 5, 6 days, 2-3 days, and they're well. And we have got evidence. Echocardiogram is there, angiogram is there. All the modern investigations are there to prove that drug is active.
So you actually have a homeopathic hospital with all the ECG and angiograms and all that equipment there, and you're able to treat them there on the spot, and you have all the graphs that show you before the remedy and after remedy.
Yeah.
Wow.
So then what has happened is now it took us about 10 years or so, a decade or so, but now my friends, my allopathic colleagues, they call me, Adil, please, we have a patient of congestive cardiac failure. Do you have something in homeopathy? And officially, you have to write the remedy. You can't just give them from your end. They will buy it from a store. So it is in their records.
That is so cool. Is that all self-funded, or is that government funded, or how do you do that? Because that would be
self-funded.
Wow, because those machines would cost a lot to purchase and to set it all up and have the hospital beds and everything. I can just imagine the logistics of getting that going would be huge.
But then we have already established hospital. My mother is a gynecologist and an obstetrician, I told you, and my father is a cancer specialist. So they need to admit patients. So it was already there. Now I have increased it further.
Oh, beautiful.
So then this is the first. Second. Third is congestive cardiac failures, heart failures. So acute heart failure and chronic heart failures. So chronic heart failures lead a very miserable life. I remember a case very early in my practice. Times of India is a very, very renowned newspaper. And I got a call at 9 p.m. by one of the very famous cardiologists of Nagpur. And he said, Adil, could you come around ICU? I said, what? Like, I'm not attached to the hospital, and how can you call me? No, but you are the only person I know who can treat heart patients. I said, okay, fine. So this gentleman was an 83 years old man, and he was gasping. He had come for a marriage from Mumbai to Nagpur for a marriage ceremony. And he got a chest pain. He was admitted in a very, very prestigious multi-speciality hospital in Nagpur. And his pumping capacity was only 10%, 10. The normal is 80%, 80. And they were giving, both his hands were fully, one IV here, one IV drug here, and he was bad. So this gentleman, this doctor, this intensivist, cardiologist, he suggested that, see, allopathy is not acting. If you want to try something else, so you can try. And so this gentleman, this patient's son, he himself is a very senior executive. He asked, what should I try? You can try homeopathy. This new boy has come up. He claims to practice homeopathy in cardiology. You can just ask him if he can do some miracles or something. And Nagpur is basically relatively a very smaller city as compared to Mumbai. Mumbai is a huge metropolis. So this gentleman wanted his father, I want to take him to Mumbai. Anyhow, I want to take him to Mumbai. Sir, it's not possible. Your father is not in condition to travel from place A to place B. Settle him down. But see, your allopathy medicine is not acting. So then he came to me at 9:30 p.m. And he said, Doctor, I've been sent to you. Could you come and have a look at my father? I said, yeah, So I went there. I saw him. His blood pressure was very low. It was only 80 systolic. And he was not good. And ejection fraction obviously was power. So he was gasping on oxygen and all. And they were about to put him on ventilator. But then they wanted buy some time. I said, okay. So I wrote a prescription of Carboveg. Carboveg is a homeopathic remedy. Mm-hmm. And I said, Carboveg 1 ml, you give every half an hour. So, and then I said, well, whatever happens, tell me in the morning. Give me a call and then I'll come. Next day morning, by 10 o'clock, he called me. Doctor, is the medicine correct? I said, yeah, why? It just costs 10 rupees. It's very cheap. How can cheap medicines act? I said, please, this is the correct price of the medicine. It's just 10 rupees, not even half a dollar. Yeah. So, if this is the correct medicine, please give it. So, and please tell me in the morning whatever happens. His phone did not come, neither the office, the hospital called me. I said, this man must have passed away. It was totally negative. Mm-hmm. But then I had this urge to go and see what actually happened. This is something, because my prestige was at stake. I was called first time, a young boy was called first time by an allopathic institute to treat to treat a patient, and that to a VIP patient. Very, very. So I went there, and this man was having his breakfast. His oxygen was out. His BP had come to 110/70 by 2 a.m. at night, and this I'm talking about at 8:30 in the morning. So between 2 to 8, he was right. And he came and thanked me. I said, I don't want your money. I'm going to get paid for that. But I just want, since you are the editor of Times of India, I want this story without names. Don't mention my name. Just mention that such an incident occurred so that someone out there may take this Carboveg and save the life.
Wow.
So just print it, publish it, wherever you want. That is the best thank you can give it to.
Mm. Oh, Adil, that's so amazing. What's one final message that you would like to share with our listeners today?
Every form of healing have their own benefits, pros and cons. But the time has come that each one of us has to see our health first and give natural therapies the first preference. And if they don't work, then go to the modern system of medicine. I'm not against any system. But yes, homeopathy has come a long way from simple sneezings and cough and cold to cardiological cases, cancers, and loads of autoimmune diseases. Homeopathy is there not only to treat you in emergencies, in acute conditions, but chronic states and complications as well. So give homeopathy a chance. Thank you very much.
Oh, I love it. Thank you, Adil. It was such a pleasure to chat with you today. I tell you what, I've been smiling the whole time and tears running from my face as you're telling these stories, and you have completely just reignited me. And please keep in touch, because what you're doing is absolutely amazing. And thank you so much for your time.
Thank you so much.
See ya.
Bye-bye.
The Homeopathy Hangout podcast is produced by Eugenie Kruger Homeopathy. For more information, visit eugeniekruger.com. The information presented in this podcast is for educational purposes only and does not replace advice from your medical practitioner. Please read our full disclaimer in the show notes. Thank you for listening.